Shabbat Shalom. Thank you, Park Avenue Synagogue, for inviting me to speak about Afya's life-saving work and our remarkable partnership with UJA-Federation of New York. The fact is we were connected before we were connected. One of Afya's board members, Mara Burrows-Sandler, is a proud member of this congregation. Mazel Tov to the B'nai Mitzvahs, Stella and Josh, on this very, very special occasion. So every story has a beginning, and I would like to start by telling you about mine. 14 years ago, I had a beshert moment while on vacation in the Serengeti Plains of Tanzania. There, early one evening, I noticed a woman sitting alone in a tent, bawling her eyes out, and I approached and I asked what was wrong. She was a highly regarded women's health physician in London, had taken a month away from her practice and her family to volunteer in rural medical clinics. Through her tears, she spoke candidly about the lack of medical supplies in clinics where she was volunteering. There were no stethoscopes, no gauze, no gloves. Like most of you, when I witness suffering, I have to act. I have been raised with the tenets of Tikkun Olam, and at that moment, I knew I had to do something. I came home from Tanzania and decided to see how I could procure medical supplies and send them to countries in crisis, so I went searching. Uninvited, I walked through the tunnels of some of the best hospitals in the world, asking to see what was typically thrown away, and I found pallets of supplies and equipment. So why is this so? What I learned was that there are federal regulations in our country that require any and all medical supplies exposed to the patient to be discarded. This is one sample. These are alcohol swab packs that are used on the skin before an injection. This issue accounts for millions of pounds of medical supplies across the United States. And there it was, the possibility to solve a problem by marrying the supplies discarded in New York with a desperate need thousands of miles away. I named the organization Afya, which means health in the Kiswahili language, and it is my way of honoring the land that whispered and inspired this work. In that moment, Afya became a reality. One man's trash can be another man's life-saving treasure. It has been 14 years since we've delivered supplies to 79 nations. Afya has grown from a passion project in my garage to 3 warehouses, 2 trucks, and a staff of more than 20. Our work is truly a trifecta of good, and we have 3 areas of impact: the environment, community, and global health. First, the environment. We are interrupting waste disposal and diverting usable life-saving supplies to communities that need them. 20 unique sites of major healthcare providing donate to Afya each year. Thanks to their work alongside us, we have diverted over 11 million pounds of supplies of surplus from our local landfills. We are a significant greening solution for New York's hospitals. Next is our community of volunteers, and the ripple of their impact crosses oceans. We rely on a robust volunteer network to sort through supplies, and over 3,500 volunteers come to Afya every year. One special story that will stay with me forever involves young volunteers who turn to Afya for a mitzvah project. The backstory of the mitzvah. Years ago in Malawi, after watching a barefoot midwife deliver the baby of an HIV-positive mother, I commented, "You are a very gifted midwife. You know the precautions, so why are you barefoot? Your feet have open sores. You know the risk you're taking." And she said that she couldn't afford shoes, and she tried to be as careful as possible. And I just sat there, quiet, observing, and thinking. As an occupational therapist, I'm trained to scan relevant information and then come up with a solution. So there I was, thousands of miles from home, trying to find a solution. She needed to be safe delivering babies. Her feet had to be covered. I kept thinking about what could be a substitute for this. Rubbery shoes, easy to wipe off, and then it hit me, rain boots. Later that night, I eagerly emailed the Mitzvah girls and asked them to get to work immediately, and they ended up collecting hundreds of used rain boots all on their own. Months later, the bush, nurtured by baobab trees, had midwives dressed in neon and bedazzled rain boots running across its land to safely deliver babies. The teens made this happen. We simply told the story of need and packed and shipped their Tikkun Olam effort. Afya also opens its doors to people who are not always welcome at non-for-profits as volunteers. We believe everyone deserves a chance to be invited to the medicine of altruism. Almost 500 volunteers with processing and intellectual disabilities come to Afya via 30 unique day treatment programs, many of which are in UJA's network. I supervise 40 graduate occupational therapy students at Afya, and they support these volunteers at the warehouse. We have also extended sorting supplies to a program with young offenders at the Westchester County Jail. There they sort and also help us to prepare shipments. During one sorting group, I shared that the highest level of giving is when we give to those we will never know, but the need exists, and because of it, we offer support. I asked how that made them feel to be a part of that kind of giving. Long pause in the room. And one inmate slowly looked up, offered a generous smile, and responded quietly like a hero. At Afya, in the giving to others is the giving to self. The ultimate objective of our work is to improve global health. I believe healthcare is a basic human right. We seek to improve global health and empower communities by providing under-resourced communities with the supplies they would otherwise not be able to financially or logistically afford or find available to them. $39 million worth of supplies have been delivered to partners across the world, including the United States. Afya is a nimble, courageous organization, and we are absolutely not bogged down by bureaucracy. It has never fit for me. So in 2017, when Syria was in crisis and the citizens of Aleppo endured daily bombings and terror, we went into action. Through a series of amazing connections, more moments of beshert, we were put in touch with the Israeli Defense Forces. The IDF was doing monumental work with the injured at the border, and now we needed their help to reverse engineer. We wanted to get medical supplies into southern Syria. The IDF was in touch with some NGOs, and together they created a list of needs. They requested supplies and equipment for a labor and delivery unit that was being constructed. Debbie Freeman's Lech Lecha was sung by the group as the doors of the container were sealed shut. Pregnant women in Syria had no idea how hard a team of people in New York worked on their behalf. We were going to help women safely welcome their babies' new lives to this world. Weeks later, the container arrived in Israel, where the IDF coordinated its transfer to the NGOs in southern Syria, and we received pictures of this incredible labor and delivery neonatal suite. In the first 3 weeks of operations, 39 babies were delivered safely. A year later, I was at a synagogue leading a big supply sort, and a group of IDF soldiers were there, and they were invited to speak about their unique experience. After my presentation, a female soldier proudly approached. I was the person in charge of the transfer of the labor and delivery supplies at the border. I have pictures in my phone to show you. I can't believe I'm meeting you here. There is great magic in the hands of goodness. Afya offers supplies through a number of programs, and one of our busiest is the Disaster Hub for Relief and Recovery. It comes alive during times of natural disasters, war, and pandemics like COVID. Here, UJA has been our exquisite partner, offering financial support to Afya that has helped us to help many during dark and chaotic times. When disaster hits, we find each other fast. The first major project we worked on with UJA was in 2017 in response to Hurricane Maria in Puerto Rico. With no power on the island, there were no working cranes to pull containers off of ships. The only hope of getting aid in fast was with airplanes. The Jewish community of New York turned into a rogue, show-up-and-make-it-happen force of nature for Puerto Rico. Our community should be truly proud of the soulful and highly impactful work that followed. Your support of UJA has helped Afya and countless other organizations to respond during times of crisis. We speak the same language, show up when needed with respect and compassion. During that time, UJA supported this effort with 29 private planes, a cargo ship container, and helped us to ship over 100,000 pounds of supplies valued at more than $4 million. These private planes were filled with medications, vaccines, medical supplies, and more. At the beginning of this crisis, there was no insulin to be found in Puerto Rico. And together, we packed a private plane with coolers of insulin, moved air vents so that the cold air would hit the coolers, and we were greeted on the tarmac by doctors and med students with coolers and ropes waiting to deliver these supplies to rural areas. They carried rope to cross rivers in order to care for those in distress. For far, far too long, we were the only ones out there landing on the tarmac each early morning as the sun rose over San Juan. We delivered hope and resources over and over again. And then our effort was noticed by the Department of Justice, and they asked us to join the Elder Task Force. Elders in nursing homes had nothing, little food, practically no supplies, and we identified abuse, needs, and cared for their patients with boxes and boxes of basic care supplies. More lives than could ever be counted were saved and changed because of our work together in Puerto Rico. During COVID, we partnered to bring PPE and medical supplies to 40 agencies in the UJA network. They were the second front line, helping vulnerable populations to remain safe in the community. We are all connected. At the height of COVID, we received a massive donation of masks from a donor in New York, and I immediately emailed Ron Richter, the CEO of Jewish Childcare, saying, "We are getting you 15,000 masks tomorrow for your staff." His response, "This is phenomenal. Thank you so much. Wow, ... extraordinary." It is what Afya does. We provide the safety net of needed supplies for the underdogs providing care, and UJA helps us to make this possible. And we have a lot ahead. Thank you for contributing supplies to our upcoming work in the Ukraine. The Ukraine military and field hospitals are located on the 260 miles of front line that serve soldiers and civilians. They're already starting to see injuries, and significant numbers of them with increasing escalation of violence. They are in desperate need of a range of supplies in anticipation of Russia invading. Afya is acting now, before airport closures and travel within country become restricted, before the surgery and wound care kits are needed to address the influx of wounded. The supplies you collected and brought will support our capacity to help these field hospitals and will be included in our first shipment. We support the medical infrastructure of the needs worldwide and after COVID right here in our backyard. We ask people what they need, and we deliver. Years ago, I asked a woman in Haiti, right after the earthquake in 2010, what she needed to function, and she responded to me, "What do you think I deserve?" Through a translator, I responded, "All the care and supplies you need to recover and to live again. That's what I think you deserve." We look forward to welcoming members of your community at Afya for a sorting event on April 1st. For those of you who will be joining us there is something spiritually beautiful about your hands being the last to touch and pack these supplies before a practitioner in need puts them to use with another. And just as this week's Torah portion teaches us about holiness and the eternal light, our work as Jews is to bring that holiness and eternal light every single day to the world we live and breathe in. Afya offers a welcoming place to bring one's holiness and then to see it ripple. Thank you.